Hello, everybody. It's wonderful to see your nice big wave. That's it. Lovely. Fantastic. I can see some amazing backgrounds there, which are incredible. So that already fills me with joy. And it's wonderful to invite you here on the breakout session for COVID-19 mental health and community resilience. We're joined by a fantastic panel here, so I know this is going to be very, very engaging. We're going to hear firstly from Father David, who will talk a little bit about his experience in the community and the resilience of the community. We've got Pete Brearley, who you heard from earlier today. Martin Haddon from Healthwatch, who will also join us. Anne Beasley is our chair. Daniel Collins, unfortunately, is not able to make it today. And we've got Dr. Ian Petch, who's also going to join us and is head of psychology and psychotherapies. So without further ado, what I'm going to do is ask Dr. David Pennells to share with us his experience.
Sorry, before we start, could I just ask you just to check if there's any deaf people in the room that need an interpreter? We don't have anyone registered, but
that's fine. Can I just ask anybody if they need a deaf interpreter? If you can put your camera on and let us know, just checking through. My colleague Alex will also put it in the chat function, just in case. So Alex, can you just put that message in the chat function, please?
okay. I think there is nobody there, but I will be around for a few minutes and then I will leave, and you can always contact me. I'll be in the main area if you need me to come back in.
That's wonderful. Thank you very much for that, Wendy. And it might be that you're needed somewhere else. So that's great. So thank you for reminding me about that. Very grateful. Father David Pennells, I'm going to hand over to you.
Thank you, Ranjit, and thank you for this opportunity to speak and for this opportunity for us all to gather. I feel this is a really important and significant day as we come together to look at these really important issues. I just want to reflect on my own experience of actually being the vicar of a parish here in Mitcham, and also reflecting on my contact with other community members as well, and thinking a little bit about how we've been managing to communicate and keep in touch, and also reflecting a little bit on those who perhaps are not quite so able. We find ourselves in a time now where the lockdown is certainly not as clear and as definitive as it was, and I think that's producing some of its own consequences now. Whereas at the beginning, on the 23rd of March, we were all given very clear instructions, we now actually have very much more discretion. And I think a lot of people are finding, after the stress of being locked down, there's as much stress once you're given a degree of permission, as well as there is in actual fact to follow a clear set of rules. And I'm finding when I'm speaking to a number of our congregation, and indeed, you know, we're using surprisingly all the media we can possibly use now. We're broadcasting services on Facebook, we're meeting each other on Zoom, we're actually uploading stuff onto YouTube, and the telephone is very hot these days. I'm finding that there are a lot of people who are now finding the situation more difficult to handle now than they did earlier on in the in the lockdown. And it's certainly not exclusively those who are one particular category. It's certainly not just older people who are finding that difficult. I'm certainly finding my own experience of people who are actually living in inadequate accommodation, certainly families where they're very stressed by living in accommodation which is possibly too small for the number of people that are living there. Certainly that is an issue as far as I'm concerned that Merton are having to face fair and square. But we are trying to communicate with people by all manner of things. And what I'm impressed by is the amount of communication networks that there are each different group, as it were. The amount of conversations I have with people where I'm told that they have been in touch with X, Y, and Z has been fantastic. And there's this wonderful, as it were, network, this sort of spider's web of communication, which has been really, really impressive. And people actually caring for each other is one of the great benefits, I think, that we're seeing. And this whole idea that people feel responsible to be in touch with people on a regular basis is all important. But I do think that there are people who are perhaps falling through the cracks, not being aware of potential mental health support, which is there. We were hearing earlier on about safety nets, but I think that there are a number of people, particularly those from minority communities, and certainly some older people who are not actually privileged with all of the communications networks that many have, to actually really find the support that they could possibly be receiving perhaps isn't there. And that is where it's so important for us to be keeping in touch with people left, right and centre. We have situations, for instance, which I've been hearing about here in Merton, of people who really are getting to the end of their tether. There are examples of violence within families, and examples indeed even of suicides more recently, where people you feel have just perhaps been struggling to actually find somebody to actually be in touch with and somebody to actually communicate with at those real times of crisis. And we really are looking now to actually making sure that as many communities are actually communicating all those different networks of support to one another. And so therefore we're mailing stuff out, we're sending stuff out on Facebook, we're sending stuff out to individual email addresses, any way in which we can communicate with people about what resources and sources of support are there are really, really important. But I do find now that when I'm in touch with people, one of the most important things that I'm having to do is just say, look, it's okay to feel anxious, it's okay to feel tense, it's a perfectly normal reaction. And to actually give people the space and that to open up is a really important thing. And that is where I feel we have many, many, many people within our communities, within our congregations, who can be instrumental in supporting people throughout this time of chaos. So there's a lot of strength there, but there's also a lot that we need to keep doing and a lot that we can do in actually putting people in touch. And the more we can continue to do so, I think the better. That's my cameo and my appearance today. I hope that's helpful. Thank you, Anne.
Thank you very much, Father David Pennells, and very grateful for that insight. I was going to just remind people to use the chat function because we want to try and keep this as interactive as possible. So please do put questions down there, and I can see some coming in at the moment. So if you happen to be in the wrong room, you will get reallocated. So just put that in the chat and we'll move you across to the right room. I was going to ask a question actually that came through from Christine. And it's really, I think, a question for yourself, Father David. Have you seen any rise in terms of the people presenting to you with mental health problems that beyond any other normal time? Have you seen significantly around COVID? Has that impacted your congregation in a sense? Yeah.
I would say certainly yes, that there is a lot more, a significant number of people who are sitting on the phone now, puzzling what and how they're feeling, and actually needing some chances to really actually spend some time exploring those issues. People actually becoming quite scared and afraid, which is a fairly new experience for many people. Actually, it was mentioned earlier, wasn't it, about people actually, venturing outside
Thank you very much, David. I'm going to bring Dr. Ian Petch in here on this one. We've had a question in from Christine, which is, are there any hard statistics from research yet in terms of the number of people attending A&E citing new mental health problems? And appreciating that we might not know the specifics around the A&E responses, but have you seen any increases in people using some of our services, Dr. Petch?
It's a really mixed picture, actually. So I think where we see people with more serious mental health problems, certainly our wards are very full at the moment. So people who need admission to hospital, we're full. And being on call this weekend, I tell you how many beds we have available. We don't have any available, so we are juggling those resources moment to moment.
Yeah, I'm not on mute at the minute.
I think also in some of our other services, we see people starting to emerge out of lockdown a little bit and feeling more confident about stepping forward. So we've seen a bit of an uptake there. I think where we expect to see the largest sort of surge in demand, which is in people suffering with anxiety and depression, we are yet to see that surge in demand. And I think we're expecting that to come a little bit later as the effects of the economic hardships really start to bite. We see more people losing their jobs, the furlough scheme coming to an end. And so our primary care-facing services are, I think, as Dr. Phil Moore was explaining earlier, gearing themselves up for a bulge or a surge in demand there. At the more severe end of the spectrum, we're just starting to see that coming in now. And of course, we have the mental health crisis unit to divert people away from A&E, and I know that they are starting to get busy.
Fantastic. Thank you very much for that response, Dr. Ian Petch. I was going to ask another question, actually, from Alan Moss, who's asked about are social care services being sufficiently mobilised? And I think that probably is a really good question for yourself, the Assistant Director for Adult Social Care at Merton Council. John, the question from Alan is, are social care being sufficiently mobilised, in your view?
Well, in my view, well, of course, yes. I mean, I can only speak about it, but since the start of the pandemic, the work that's been on across adult social care and our partners has been fantastic. If I just start off with the staff group, our staff have been fantastic across the entire system. Our working life has been completely up in the air, and at the same time, our private lives. So people have had to go home at night and queue for shopping, queue in lines, had to try and order food themselves. So we've had to think about our own staff. But imagine there are 37 care homes. Those care home staff have gone to work every single day. They have had very limited supplies of PPE because there's been a national shortage of PPE, and they have gone to work every single day. We have 800 people receiving care from us on a weekly basis, a daily basis, home care, with 25 home care agencies. And those carers have gone out every day, and those care providers have provided the same high quality service to the residents of Merton and across southwest London as they did before. So yes, I think they are, but we couldn't have managed without the entire system. We are providing a service to about 7,500 people who are shielding in Merton. So the clinically extremely vulnerable people that is defined by the government. And we've been providing support to them. But we haven't been doing it alone. We've been doing it with pharmacists, with the voluntary sector, with the entire system coming together. So while I think, yes, we have, there is more. Because what this is throwing up for me is that we've been speaking about integration in the 20 years I've been in adult social care. But in 2 days, a week, we work together quicker and closer than we have done in those 20 years. And a lot of that is because we threw the roadblock out. We still maintained our statutory functions, but we worked better together. And we threw money out of the window. We didn't have any disagreements. Well, this is you to fund this, this is us to fund this. And this is the thing that we need to build on moving forward. Working closer together and integrating so that we work as one system.
John, thank you so much. So your message is loud and clear that we need to work together and be more integrated. And through COVID, actually, that's allowed us to happen and throw some of the old ways out and work on new ways. I might, if I can, just go to Anne Beasley, who's the chair of South West London St George's Mental Health Trust. Annie, do you have a view on what John mentioned about more integration and how things could potentially change going forwards? I think
you're muted.
No, you're okay. We can.
Yeah. So I think that actually, certainly the health system has worked well over the last few months. So there was a question in the chat room about people presenting at A&E. I'm also vice chair at St George's, and actually we've had much fewer people presenting at A&E, but actually the facility, the Orchid facility that's specifically designed for patients presenting with mental health issues has been a real success, and the whole system then around emergency access is much better. So I think we have worked very well together, and we need to ensure that much of that continues. I think the bigger point is, how do we work together with all of the agencies? So I think health works well together, but are we as joined up as we need to be in primary care, in social services, in what's going on in public health? And that's where I think some of our conversation today may start to lead us onto a path where we do work much better together.
Thank you very much for that, Anne. And that's a very helpful discussion point for us in the sense of how do we come together and the purpose of the site. So really appreciate that. And we've got another question actually, which is again, Alan's using the chat function to ask lots of questions, which is really helpful. It's exactly what we want. So I will encourage more of you, please, to use the chat function. Just before I go to that question, if you have been allocated to a room that you would rather go into another room, we are having capacity issues in various spaces. But if you would like to leave to go to the main room, we can see where we can allocate you again as appropriate. But I'm just going to ask the question in terms of, do we think carers are getting the support that they need? Have we recognised the toll on carers and possibly the fears that people are facing as a result of the fallout of COVID and the demand on primary care services? So I'm going to come to Martin Haddon, who's from Healthwatch Wandsworth in a second, but we're also lucky enough to be joined in this breakout by Phil Moore, who you would have heard speak in the main session. So Dr. Phil Moore, your views in terms of carers and the impact that COVID has had on them, do you feel, are you seeing that in your surgery? Are you seeing changes? I think we should just be unmuting you now. We'll come back to Dr. Phil Moore in a second. Martin, can I ask you the question in a sense from Healthwatch? Are you getting the same feeling that Alan Moss is around carers? I have a feeling that Martin may have left the room.
No, I'm here.
Oh, there you are, Martin. There you are. Fantastic. Oh,
Um,
please do share your views.
I was muted, sorry. Well, thank you for putting me on this panel. I'm not quite sure why I was chosen for this. I think there are probably others in be better qualified and able to do so. But I don't think at the moment, I mean, I'm to be honest, feeling particularly de-skilled at the moment. There is a great lack of information flowing that I can sort of pick up on, and all the kind of connections and links that one has have been kind of interrupted and broken. So it is quite hard to function in the way that Healthwatch has done before. But we are trying our best to keep in touch with things. I'm not particularly aware of anything specific
Sure.
about carers, although quite clearly, you know, the present situation does put a lot of pressure on people who are caring for vulnerable people.
It really does, Martin.
I think we are aware of quite a kind of general level of anxiety.
Sure. Martin, that's really helpful.
And
Thank
when
you.
we did a survey about people's experience under COVID, I think quite a lot of people felt that their mental health had been impacted, but weren't very clear, kind of, you know, weren't terribly able to articulate how, and weren't terribly clear how they could get help. So I think it's a fairly diffuse feeling.
Sure. And Martin, that's really helpful. Thank you very much. And Martin's from Healthwatch Wandsworth. Thank you for that. John, I could see that you hand up there.
Yes, I actually thought it was a really good question. First of all, the pandemic has highlighted the importance of issues, the importance of carers, as it always does. The system cannot manage without carers. At the start of the pandemic, and I'm speaking about Merton, we've got 4 day centres. We run 4 borough-owned day centres. 190 people attend those day centres again. Prior to the lockdown and us being told to close the day centres, families already started taking their loved ones out and shielding them. So families took the decision, we're not sending our loved ones to the day centres anymore because there's a high risk they'll catch COVID, and they started removing those people from the day centres. Lots of people stopped as well care packages for their elderly parents. So they started providing the care themselves and looking after themselves. And a lot of people are still doing that. So what it has highlighted is the importance of carers, but also that we don't do enough for them. And I'm not speaking about Merton, I'm speaking about as a system that we don't do enough for them. They are taken for granted slightly. So for me, moving forward, we need to do more work with carers, provide more support for carers, because again, we can't manage without them.
John, thank you so much. I think that's a very helpful response, and very grateful for that. Pete Briley, who's one of the lead organisers for Citizens UK, who you would have heard speak. There's a question here really around from Hina, which is due to the need for physical distancing and the changes in terms of how people come together. I mean, it's wonderful we've come together in this way. And we also heard about Vanessa talking about digital poverty and also digital literacy. How is the new world going to change in a sense of how voluntary and carer services join up and work together to really outreach to those who are known forward for help in the way that they would have previously? And what can we do differently? Can I put that to yourself, Pete?
Yeah, I just want to I'll just add on what John was saying there. I think that's absolutely about care workers and like I said earlier, what this pandemic has done is made us more attentive to certain things. And we've all become more attentive to the role that carers play in our communities. Since some of you won't know, but we started the Living Wage campaign, which has been adopted very well by all sorts of businesses and organisations and government, but actually care workers still don't get a living wage. We had one care worker say she couldn't work for 29 days and had to rely on food donations from friends and neighbours because she was on a 0 hours contract and on the minimum wage, which left her with no safety net. So I think just from that point of view, getting a living wage is really important. In terms of the answer to the, you know, how do we continue to connect in creative ways? I would say one thing that is certainly interesting is that some people that weren't previously able to connect are now able to. So there have been some benefits, but you're absolutely right, Ranjit. There is a huge problem with digital exclusion. You know, which communities are in? You've seen mutual aid groups do things about this. You've seen local churches and schools, etc., to kind of do stuff. At its very least, what we need to ensure is that people have access to a computer and access to internet. We've seen groups of people kind of having to raise money, but what more could government do in that space around ensuring that people have access to those things? But we also know it's not just about having access to it, it's about learning how to use them. That's where I think the really interesting story about some students at Ravensbourne College who were connected to some older people who didn't know how to use to teach them to do it. So we're all in situations, I think, whereby we have some of those connections. How do we use them? How do we teach people that perhaps can't connect to ensure that they do connect? So yeah, the other thing I would say about social distancing is it's an interesting phrase, isn't it? Because actually at a time when really I think it should really be about physical distancing. And the dangers of what we've had with social distancing is that people have felt that they need to disconnect socially from people. And actually, we shouldn't be encouraging people to socially distance. We should be encouraging people to physically distance, but socially connect.
Pete, thank you very much for that. And I know that we'll have some more questions around that. That's really helpful because we are all struggling with that in this new world that we find ourselves in. Just on a previous point around the impact of carers, Hannah Davis has said from Wandsworth Carer Centre, they've seen a big impact on a large number of carers and their mental health and feelings of anxiety during this time. I'm also delighted to welcome back Dr. Phil Moore. Hi Phil. I know that you had to take a clinical call. There was a question in terms of the impact of COVID and whether we're seeing further take up in A&E services and others. But I wanted to actually pose a slightly different question, which was, in your frontline role, are you seeing any post-traumatic stress disorders in frontline staff having to deal with COVID? Is that something you're encountering?
It is indeed, Ranjit. Not huge numbers to date, but the numbers are beginning to increase. I've certainly had frontline staff come in to talk about their difficulties and had to refer them on to services. Certainly the professional health program that's run in London or across the country, it reports an increase in the number of doctors referring themselves there with anxiety, stress, and sometimes depression as well. And overall, the numbers are beginning to ramp up. I've been in contact with primary care staff around the country, and they are all reporting that the numbers are creeping up. It's not an avalanche suddenly, but they are beginning to creep up, and it's giving us time to begin to plan our services so that we don't get overwhelmed by them. There's a lot going on with psychological services. There's a lot going on across London to plan those services, but it is not straightforward, and it's not going to be easy without some funding that enables us to provide the additional services. So those are the kind of things that are being faced, but it's beginning to creep up quite inexorably.
Thank you very much for that, Dr. Fillmore. And whilst I've got yourself here, and I'll come to Dr. Impech in a second, Michael Derry has asked, to what extent are wider determinants of health involved in people's presentations, and to what extent are they being worked into people's recovery? So what challenges are we seeing arising from the changes available to support and from the voluntary sector?
So let's take the first question, if I may, and that is, are the wider determinants of health involved? Absolutely. You can imagine that if you're middle class and you live in a nice area, you've got a garden, you can work from home because you're well connected with IT and so on and so forth, you can get by pretty well and you may quite have enjoyed lockdown. If you're in an overcrowded flat, you have ceased being furloughed and you've lost your job, you've got children with high levels of needs and perhaps mental health needs, and you are having difficulty getting out anywhere, you can imagine that the mental health needs in that situation are escalating without any possibility of comparison. So the wider determinants of health are absolutely fundamental to the mental health needs that people are presenting with. In terms of the voluntary sector, yes, we do need to make use of them. We're not without the voluntary sector. They are already being mobilized, but we need much more of it. And I think one of the key people that are going to be helpful with that are the social prescribers within primary care who can help to signpost people to those services. The people with the highest needs are going to need more than signposting. They're going to need some actual help and befriending to get to those services, because they're not going to have the capability to just get there on their own. So I think we've got to be very aware of where people are coming from.
Dr. Fillmore, thank you very much for that. Really helpful to give that overview for people. I'm going to move to Dr. Ian Petch. Lisa has asked, what are you finding people are reaching out for the most, and what help in particular are they looking for? I know you touched a little bit on this, Dr. Petch, earlier. Is there anything you want to give a further update on?
I think it really varies depending upon which service we're looking at. And in fact, I think, although I know Phil's already mentioned, there is a slight sort of upturn in the demand for support with certain kinds of difficulties or needs. We're not getting a huge amount of reaching out at the moment. We are, I think we've heard some of the other participants touch on this, that there are people who are not really aware of the mental health support that is available. And I think that's going to be a key issue as we look to the future. How can we make sure that people do actually reach out and ask for the help that they could benefit from? We know that there will be many people, at least 20 to 30% more than usual with mental health problems. And we're not getting a lot of people reaching out at the moment. I think where we do see it, people are anxious, people are worried. We see some slight upturn in people who are perhaps overly concerned about cleanliness and contamination, but we're not seeing a huge surge. I think it's mainly people with lower levels of depression and anxiety, but actually I think what we need to really do is focus on making sure that more people are aware of not only the mental health support services available and the primary care support services, those social prescribing options that Phil's already mentioned, but the whole range of wellbeing support options out there in the community, so that people know where to turn to for help.
Thank you very much for that, Dr. Ian Petch, and a lot for us to reflect on there. We are going to be wrapping this session up in a few minutes. Time is running away with us, but I'm going to do my very best to try and get in as many questions as I possibly can. Heather Hamer has just said that there are a number of other services, voluntary services that are available, 12-step programs, lots of meetings, so please do use those and utilise those, are really, really important. Some of the other questions that we're getting in are around some of the groups that are available. Learning disabilities also may have mental health issues and the impact on their families and carers. John, do you want to just say something a little bit about what work is happening to support people with learning disabilities?
Well, of course, I can only speak about Merton. So we've, as you know, our day centre is closed, as I was saying earlier on, but we've started more outreach work. So we've been, our care staff who are working in our day centres have been going to people's houses, taking them out, providing more support to them. setting up Zoom and Skype calls for people to be able to meet to each other that are normally at the day centres. We've been doing much more of that. While I'm a real fan of Teams and a real fan of Zoom and all the rest, nothing beats meeting people in social interaction. So for me, I can't wait to get back to we can use both, so that we can use the technology, but also the face-to-face meets as well.
Fantastic, John. Thank you for that. And I know many people feel that way, don't they? They feel that it's been a great boon to be able to use digital technology and to allow us to come together in this way. But there is something really special about our human behaviour, which is being in a room with other people. And so it's been a big strain. And I think one of the comments, I can't see who I can attribute to at the moment, but one of the comments was also the transference of emotions and how emotions can get transferred onto other people, which is a challenge in itself. I'm going to start to wrap up very shortly, but I'm just going to go through the panelists very quickly to ask if there's a message you'd like to say in 60 seconds to people, what would that be? So I'm actually going to start with Father David. I'm going to come back to yourself. If you're happy just to give us a quick reflection, what a takeaway you'd say to people.
On mute, that's it. Two things really. I think one is the whole cooperative way in which different people are working together is something which is developing more. One of the other things is this whole issue, I think, about the fact that we are learning new communication skills. And we need to be actually using all of those communication skills in future, because I think there'll be a great benefit. I quite agree we need to be face to face, John. But in actual fact, the fact that we can be in touch in other ways now, in ways that we never dreamed of doing in the past, is a really great advantage. And I think that will actually be something which can be really beneficial for the future.
Thank you, Father David. You probably would have noticed a pop-up box saying leave breakout room, but please don't do that at the moment. We are unfortunately not hear from everybody, but I'm going to go to Anne Beasley, our chair, just to give us a quick 60 seconds view in terms of a takeaway for people.
So I was thinking about the comment that Pete made earlier about creating an army of mental health champions, and it's about social prescribing and befriending. And the question in my head is, how do we create a society that is friendly to those with mental health issues? It's about changing the water, isn't it? Not teaching people to swim in the existing water, but how do we get together and change the water?
Thank you very much for that, Anne. And thank you very much, everybody. Thank you very much to our panelists. I really think that we could have had a whole session just on a Q&A like this. And perhaps we may do that going forward. And if we didn't get to your question, please forgive us, but we will aim to try and answer that directly. But please do click the button to leave breakout room, and we'll see you in the main session for the plenary discussion. Thank you, everybody.